If you start thinking about these enabling technologies, from this list, you can quite clearly make out the fact that had COVID hit us even 2 decades back, which is, let's say, early 2000s, we really did not have any of these technologies at the shape and form that we have them today to really be supporting us with these innovations. There was no additive manufacturing, robotics, and AI wasn't developed to the extent that we have it today. Internet facilities weren't that good for crowdsourcing to be thought of in the scale that is being thought of today, and we didn't have big data analysis skills to support these. So, though these are key enabling technologies for today, 2 decades back, we might have found it a lot more difficult to handle the pattern. Now that we have these, let's look at how these technologies have been supporting us. With regard to additive manufacturing, we are talking about 3D printing predominantly, which has helped us creating face masks, nasal swabs, and at a large scale at which we want them now for handling the COVID pandemic. Looking at robotics, we have startups like Asimo Robotics, which have developed bots called the Karmi bot, which are being used at entrances to public spaces, also in hospital isolation wards to help with medical staff, social distancing, all these different requirements of COVID. The Spot robot from Boston Dynamics is helping a lot of frontline medical staff, similar to the Karmi bot, in settings like parking lots and tents where they are doing testing for COVID, and this bot is helping them with things like that. An IAMK incubated startup has developed a robotic arm which is helping with taking swabs without human contact, which is helping medical staff and protecting them from direct contact with potential patients. Crowdsourcing is another area which has been helping us a lot. If you look at IEEE Kerala section specifically, they have had a history of using crowdsourcing for similar emergencies. Specific case and example being KeralaRescue.in, which was used during Kerala floods for coordinating flood relief, rescue, and rehabilitation. Those ideas are now being used in the COVID situation as well with crowdsourced innovations like Corona Safe Network, which is an open source public utility that is bringing together innovators, volunteers, educational institutions, government into a single portal to provide innovations for COVID. Break Corona is another example, which is being started by the Kerala State Startup Mission, which allows a lot of innovators to come up and post ideas and then collaborate to bring up innovations for the COVID situation. Machine learning, artificial intelligence is another area which is really helping us a lot. Blue Dot is a startup which has developed a system that is helping with warning systems for infectious diseases. And in fact, they came up with the first scientific paper on COVID-19, which was predicting the potential spread of this virus across different countries, which has been helpful with modeling for healthcare infrastructure and things like that. Another for a machine learning startup product is C19 Index, which is developed by closed loop AI. This provides like a artificial intelligence based predictive model that helps to identify the vulnerability index of potential people with the COVID virus. And similar examples are also there with open research data sets like the one that's been provided by the Allen Institute for AI, which is helping a lot of researchers to open source use natural language processing and such AI methods to predict and look at COVID infections and their disease spreads and all of those things. Talking about big data, again combined with AI is helping us a lot. The Johns Hopkins Institute has this dashboard where they have a heat map of where the infection spreads are, what are the infection rates. All these things are really helping us with looking at how does the infection spread and how does the health infrastructure need to respond with the infection spread. A homegrown app, the Arogya Setu, which is being promoted by the central government in India, is again using similar AI big data methods, pulling in information from Bluetooth and GPS to help know COVID infection spread, identify COVID patients, and identify vulnerable hotspots for COVID.